Femoral acetabular impingement, more commonly known as hip impingement, stems from dysfunctional contact between the ball and socket joint of the hip. Surprisingly, this injury can go undetected for years in active adolescents and young adults. As the patients age, however, this prolonged friction causes cartilage and joint damage, resulting in a great deal of pain in the groin, hip, and thigh, as well as limitations in range of motion and potentially osteoarthritis.
So we have it as a developmental problem where we could be born that way, or we acquire it through various activities. And basically what happens with the extremes of range of motion, we get bone-on-bone abutment. The body doesn't actually know what's going on, it just knows it needs to fix it. So what actually happens is we start to get additional bone laid down. And as we then try to go to the end ranges of motion, the two structures that make up our hip, or the bones making up our hip, impinge on one another, and we're not able to get the extremes of the motion we had to begin with.
Treating this injury can involve surgical procedures, but most of the time, conservative measures are just as effective. Beginning with rest and activity modification is a great place to start, but the true progress will be seen in therapeutic exercises that strengthen the muscles that support the hip.
Well, there's really two approaches when you deal with femoral acetabular impingement. There's the surgical and non-surgical approach. Surgery makes sense that a surgeon would go in and recontour the bones, whether it be the long bone of the femur or up at our hip joint with the acetabulum, but they can go in surgically and contour this. One of the things that we've played with, and it actually works reasonably well, and it all is on a spectrum of pathology, is positioning the hip, or working on exercises of posture of the hip. For example, if you stood up and you tipped your pelvis all the way forward, think of your waist as a big bucket of water, and we're trying to tip that bucket out forward. If we go all the way to that forward tilted position, ultimately what happens is we actually bring the two bones closer together. And in case we've actually manufactured an impingement, so to speak. So if you just think about one way we might look at a conservative method would be then trying to get the person to tip the bucket back the other way with exercise. And there's very specific exercises we can do. And by doing that, it opens the hip up, creates more space, and reduces the impingement.
Nashville-based physical therapist Dr. Voight is incredibly familiar with the treatment of many dysfunctions of the hip, with a special interest in impingement. He uses the innovative loops of the TheraBand CLX band to formulate some of the most unique, effective exercises that can help increase hip strength and reestablish range of motion. And today, he's going to be sharing his favorite exercises he's created over the years. Grab a band and a stability trainer and follow along with Dr. Voight to up your rehab game.